How's everyone doing today? And welcome to EMRA Spotlight Series. Today, we're going to have Dr. Saad with us, and I am very excited to talk to her. So I'm going to wait for her to join this live. A little bit about Dr. Saad. Dr. Saad graduated from the Faculty of Dentistry, University of Manitoba with honors. And she was a recipient of many awards in periodontology, practices management, and treatment planning, pediatric dentistry. She is a board certified in Canada as well as the United States. Hi, everyone. Thanks for joining. And let me see, accept. And we're going to be talking with Dr. Saad. She's an amazing dentist. She was selected as top dentistry. Go live. She was selected as a top dentistry by the Consumers Research Council of America in 2010, 2011, 2012, and 2013, and 2014. She was also selected as top dentist in South Jersey Magazine, June 13 and 14. Furthermore, she was selected as Doctor of Excellence in 2013. I'm very excited to be talking to her, and she's joining us soon, and you could probably ask some questions. If you have any questions for her, I will look through the chat later on and see what's happening. So she's connecting, so we'll see. I can't wait to talk to her. I already talked to her a few days ago, and we're very excited to talk to all of you. Hi, let's see who's on. Dr. Hunter, hi. And Tonya, who else is on here?
Can you hear me?
How are you?
Good. How are you?
Good. I'm very excited to be talking to you.
Me too. Thank you very much for having me. This is fun. Yeah.
Yes. You have so much going on. So let's see. Tell us a little bit about yourself, your background, and like in resume, because you have a lot going on, but a little bit. Yeah.
There is a lot of layers in me. Yeah. All right. So first of all, I am a mom. I am a dentist, and I really love what I do, and I love to help people. That's really basically what I love to do. So I became a dentist many, many years ago.
Yeah.
Like I have probably over 20 years of dental experience, and I practiced in Egypt. Then I moved to Canada. I went back to dental school there, graduated with a DMD with honors, and moved to the and actually practiced there as well. And then I moved to the United States because of my husband. And I'm actually happy that I did that. He's a good guy. So, yeah.
How do you meet?
What's that?
How do you meet? How do you meet your husband?
Met in Canada. So he came for a conference. He is a professor of computer sciences at Rutgers, and he is the founder of the AI lab. He's very big in artificial intelligence. He's actually traveling right now, keynote speaker, some place in Europe. So he's all over the place as well. Yeah. And we met in Canada in a conference, and one of my friends like, oh, I just meet this guy. And I guess, it kind of worked out. And I really love what I do. I always loved art. Basically, when I was a little girl, I really liked art and drawings, and I was always fascinated by nature and how we can draw like flowers and the skills of basically trying to imitate that. So that was really how I started to get into art and making a little sculptures. And I think that's really what got me. I had braces, and I really liked my orthodontist. And she was amazing. And I said, you know what? She's helping me. She helps others. I think I'm going to be a dentist. That's really how this whole thing started with me.
For you. Wow.
Yeah.
The road. It's like it was a nice dentist, and you were like, I love this. I love how she treated me. I want to do the same. That is so cool. So you also have two kids, and you said, how old are they?
So one is 11 and one is 13. The little
Okay.
one might become a dentist. He's very artistic, very like he blows my mind away like drawings. And
Yeah.
he's like, teach me everything in dentistry. I'm gonna be a dentist. He told me that. I said, okay, sure. No pressure, but I mean, so he's really into making arts as well. So I we'll see.
We'll
We'll
see.
see, but no pressure. Yeah, no pressure.
Yeah, that's awesome.
Yeah, yeah, and I have a cat, and he's sitting right here watching us right now. It's like, yeah.
And besides from your kids and the dentistry, you also have a YouTube channel where you
Yes.
share information with people. So talk to us a little bit about that.
So it actually started as a podcast. So I have the major thing is I have a podcast and it's all over like Spotify, Google, podcast, Apple podcast. It's Audible everywhere. And it's called the Wonder Tooth Podcast. And I started it because, as I said, I really like to help, but I also like to educate. And the big thing really in my practice, so I also created that beautiful practice in Princeton, New Jersey, where I like to sit and discuss with the patient what's going on. And I have this huge TV monitor, like huge, like 55-inch, and I put the x-rays there, and I take intraoral like pictures of the teeth, and I go one tooth by one tooth, and I explain to them what's going on, what's happening, what's the treatment, what we need to do. And sometimes they look at me, it's like, okay, this is a little bit too much. And I say, okay, well then I grab a piece of paper and I start to draw, and I'll be like, this is what's going on, and this is how we need to fix it. Then they
Yeah.
start to get it, they understand. Because if I keep telling them, you need to brush, you need to floss, you know what? Yeah, they might brush today, tomorrow, then they're gonna forget. They're gonna floss maybe a couple days a week, and then they're gonna forget. But if they know the science behind it and they understand why they need to do that, especially if they have, gum problems, or they have heart disease or have diabetes, then they really, okay, this is serious now.
Yeah,
So
because
I said,
like you just mentioned diabetes and heart disease, like you don't always like correlate that with tooth issues. So how is that like correlated with each other? What's so important?
A very simple thing. Like this is usually when I tell this to the patients, okay, now we understand. You know the sea? You have this beautiful fish swimming on the top, and they're gorgeous and they're colorful and they're happy and they're swimming together. And so these are the bacteria that lives in your mouth in general. Your saliva has millions of bacteria. They live there. They live in harmony. If you take a little bit of an antibiotic, your immune system is going to go lower. So, okay, now the candidiasis is going to happen, the thrush. So these are the bacteria that live in the mouth.
Yeah.
If we start to get gum disease, so the gum disease are basically, what is a gum disease to begin with? The gum, the gingiva, if it starts to bleed a little bit and you brush, you floss, it gets better, that's mostly gingivitis. That's reversible. If you start to get, so you have the root of the tooth, it's attached to the bone by a little tiny ligament. That ligament, if bacteria starts to get in there and start to literally, secrete acid and enzyme and start to eat the ligament, basically now you have what we call a pocket. That's called the periodontal pocket. And they start to go deeper. When they start to go deeper, then they start to become what we call anaerobes, different types of bacteria. These are the ones that are the vicious, the ones that don't live in the air, the very strong, vicious ones. And these are in the ocean, the ones that live in the deep seas. The big scary fish with the long teeth and the lights. That's basically this. This is what it is. So these are the really vicious bacteria that live deep down there. And they're not going to sit there doing nothing. Okay, well, you're giving them food every day, so they're having their best life. So they keep eating they keep eating the periodontium, and they're also, the bone doesn't like that. So the bone is like, what's going on? I don't like this. So the bone starts to shrink down, and the gum on top starts to follow that and starts to shrink down. And this is what we have, gum disease. Now, why these are a big problem? Because that particular type of bacteria, they can get into your bloodstream and affect the weak areas in your heart. And they actually correlate very highly. They work very well with sugar. You're giving them sugar. This is the best treat they ever give them. So basically, your blood sugar starts to go really high when you have gum disease because it's an infection. So when you are when you are diabetic, you are very prone to infection and inflammation. And gum disease, that's an infection. It's a localized infection in your teeth. So you got to take care of that.
Yeah. And we were talking also about mouthwash.
Yes.
How that is not good at all.
So there are different types of mouthwash. And I'm not talking about the different ones in the store. Generally talking, there are different ones. So there are the ones that are medicated and the ones that are over the counter and the one that you can just do at home and the ones for whitening. There is like then the one with fluoride. Don't get yourself confused. Here is what I say. The most important thing really for teeth, brush really well until there is no plaque on your teeth. Then floss really well until there is no plaque between your teeth. Because the tooth is basically like, okay, the tooth is like something like this, okay?
Yeah.
It has 4 surfaces here and then a surface on the top. So the surface on the top and the 2 on the side, you get them with the toothbrush. But what are you going to do between the teeth? You have to get the floss in there.
Right.
And I'm talking their actual string. Don't use the stick. The stick is like better than nothing, but it doesn't clean. You literally have to put the string in between. You have to kind of use it as a saw around one, like let it hug one tooth, clean, pull it, wash it because there is plaque on it. You don't want to go back and put the plaque again. And you go in the same area around the other tooth and you're going to clean that. Then after that, okay, mouthwash. I have a bad breath. What do I do? Well, bad breath will come if you're not really cleaning properly between your teeth, if you still have plaque. Okay?
Yeah.
Okay? That's number 1. Number 2, which is a lot of people, they forget about that, is the tongue. You know, your tongue has tons of stuff going on there too, bacteria, they sit there. So the top part of the tongue, you have those filiform. They literally look like, you know, those beautiful corals, they look like this. They're very long and sometimes they look white. And when they look white, this is when you need to scrape them. Not to brush them with the toothbrush. Scrape. There is something called the tongue scraper. And you go on this and you you'll be surprised. You'll be super surprised of what's going to come out of this. But this is one of the big problems too, that can cause bad breath. And also if you have sinus problems, that can cause bad breath because you have the postnasal discharge. Or if you have, or if you have stomach problems, acid reflux, all of that can cause bad breath. It's not just the teeth. And the mouthwash alone is not gonna, it's just gonna cover this. It's not gonna treat the problem.
Yeah. Yeah. I kept seeing that online, you know, how certain things keep popping up. And I was like, it's something that everybody uses, but it's something that you don't really need. You should be using.
Honestly, I personally, and probably a lot of the big companies are gonna be, I don't use mouthwash. I don't use mouthwash. Period. And you know why? Because I'll tell you why. Because the mouthwash, overuse of a mouthwash is actually going to change the microbiome. Those beautiful fish that are swimming, it's gonna change that. It can actually affect the bacteria that are living in harmony, and then some of them can cause more deposit buildup on your teeth, believe it or not.
Wow, that's crazy.
Yeah, but they don't tell you that. Oh, buy this. No. I'm not gonna say names, but buy this. This is good. Oh, it smells fantastic. No, what's gonna smell fantastic is if you really brush well and if you floss well and you take care of your tongue. This is what's gonna. And you know what? I tell everybody in my office, warm salt water. They look at me as like, what? Yeah, get your kitchen, get a glass of warm water, put a teaspoon of salt, and after you floss really well, like really, really well, use that.
Yeah.
And you're going to have a fresh breath. That's it.
There you go. That's all you need.
That's really it. That's the bottom line. Of course, you have to go, get your checkups and cleaning, obviously. But really, overuse of mouthwashes can literally, it can affect the harmony of the bacteria in your mouth. So some of them can start to go a little crazy. Some of them can, because, it's affecting them.
Yeah. Now, tell me, what's your favorite thing to do
In life or in dentistry?
In dentistry. In dentistry. Do you have like a favorite thing that you like love to do?
Well, I love. I do a lot of the. I love every aspect, but I really like cosmetic. I'm really, really, really enjoying cosmetic dentistry because I do also digital dentistry. I'm not just let me send it to the lab and we take for no. We are much more than this. That's why we call our office. So basically, we have 3D machines in the office.
Yeah.
So we don't do the gooey mold no more. That I stopped using that like 9 years ago now. So basically we have 3D scanners. We scan the teeth.
Yeah.
Let's say the patient comes, like I actually had a patient earlier today. She came to me for a consultation because she went and she got a smile makeover overseas.
Oh.
Like, the big Hollywood smile. I wish I had her pictures with me. Big Hollywood smiles, like white teeth, top teeth, bottom teeth, all her teeth, overseas.
Wow. Did she get infected?
The big problem now is she has infection in every single tooth. Her gums are bleeding like crazy. She cannot clean. And I saw it today, and we had to sit and put a big treatment plan because I have to clean the foundation first. I cannot, unfortunately, clean the foundation unless we get rid of they're very bad dentistry. So how do I do that? Yeah, it's gonna be a big, long, extensive, but she's young. And I said, if you keep these in, those teeth are gonna get so decayed that the whole thing is gonna come off and you're gonna have no teeth underneath it. It's really bad. But let's go back to cosmetic dentistry, which I really like. I'm just giving you awareness because I also posted something recently about illegal dentistry and veneer tech. I'll talk about that later.
Okay.
Yeah, I'll talk about that in few minutes. But cosmetic dentistry, it's basically when somebody comes to me and the front tooth is broken.
Yeah.
Fix it. Oh my God, I have a meeting. My wedding is like next week. What do I do? I've had this so many times. So what do I do? So remember the 3D scanner that I have in the office? We scan the teeth. And basically, okay, we need to put a veneer or we need to put a crown or something, and we numb the patient. And this is all in one appointment. Then I can design the tooth basically to be exactly a replica of the one next to it. So it's like complete symmetry.
Wow, that's
and then we select the color. Yeah, we select the color, the shade, and we can match that. I'm really good at this, like matching the shade of the teeth. And then we have the 3D milling machines. They mill the crowns on the spot. So the patient comes, like let's say at 9 o'clock with a broken tooth. The patient leaves at 10:30 with her teeth fixed.
That's amazing.
Permanent veneer or permanent crowns in the mouth done.
Amazing.
Yeah.
Wow. How do
Yeah.
Yeah, you don't get that everywhere. It takes
don't get that. So this is digital dentistry at its finest, not just this, because some dentists, they have the scanner, they will still send it out, but we are fully digital, so we have the whole workflow.
And what's your exact address?
So our office is Dent Blanche Dental. It's French. It's like, if you write it down, it's like Dent Blanche Dental. It's 3640 Lawrenceville Road in Princeton, New Jersey.
And what do you only do veneers, or what else do you do there?
We do a lot of, I do also implant dentistry. I have a master's in implant dentistry. I actually won an award, it was a big award, internationally. I was like, okay, I didn't even think of it. I was like, okay. They told me, and I said, what? And they said, yeah, your presentation was amazing. I said, okay, great, thank you. Yeah.
Yes, why not?
That was actually before COVID in 2019. It was in New York.
Yeah.
Yeah, and I said, okay, fantastic. We had a presentation, and I presented I presented basically what I'm doing, like what I am doing and how I do digital dentistry and how I implement everything together.
Yeah.
And yes, they really liked what I was doing. So yeah.
And not a lot of people are doing that. It's impressive.
Yeah.
Yeah.
Thank you. Yeah, it's digital dentistry is really fun. And so why do I like it? Because I see the tears in the patient right away. oh my God, my teeth, my face, I can smile now. I've had this so many times. It makes me, I don't know how to explain it, but it makes me so happy. So happy. It fills my heart. It really does. And I feel, okay, now I'm really helping this person. Like I had patients, they would talk to me like this, like, and I'm like, what? Talk to me. And they're like, I can't.
Yeah.
So now after I fix their teeth, they're like, okay, now I have to train myself to smile again.
I get that. I've met people who don't want to smile because I'm like, I'm a big photo person. It's just like I'm always like taking a picture and I'm like, smile, smile, but they're like they didn't want to smile because they didn't like how their teeth look. So that's very important for sure.
Yep. So it makes me very happy. Very happy.
And we were talking about the podcast that you now have a YouTube channel from the podcast. So what else are you talking about in the podcast? Is it all like dental or do you talk about anything else?
Most of it is, the majority is dental, but also I would like, add few things. Like one of them, it was about dental insurance and what's going on with dental insurance, and everybody's like, what is happening? And some of them are also like medical related to dental. Like, I had one of them was with a cardiologist, like, okay, the disease, what's going on and why this is affecting that. But also I talk to people, like empowering people, like influencers, like, okay, this is the beginning of the year. What are we going to do?
Right.
Okay, we need to set like, okay, project, like 1, 2 goals. What do we do? What are we going to do? And one of my biggest actually interviews was with a phenomenal lady. She co-founded the biggest translation company in the world. Phenomenal businesswoman. And she is in New York. And she is one of the most influential, like she's very, very big. And she published a book. And I said, I'm reading the book. Can we talk about it? So she spoke about the journey and how she literally made it from nothing. Like she was in debt. And then she built her company. Her company is worth like $1.2 billion now.
It shows that everything is possible. You just have to keep
going. Everything is absolutely possible. Yes, you just have to keep working. Don't stop and don't feel bad for yourself or sorry for yourself. Yes, you have to learn. All of us, we make mistakes.
Yeah, and if, like for a second, you could like drain a little bit, but then just pick up. Don't stay there too long. I feel like you have to like let it go. You have to cry it, and then just move on. Take some time to recharge and move forward.
Absolutely, it's very important. And you know what? We can do anything we want. Really, if you put your mind into it, you can do anything you want.
You just have to have that desire, because like sometimes you try to help other people to kind of get there. Yeah. But if the desire is not completely there, it's kind of like hard because they have to want it. You have to really want it because it takes work. It's not like,
absolutely.
Even if you give it to somebody in their hand, sometimes it doesn't work.
You have to have the passion for it, the passion.
Yeah.
And you just have to keep going. So you never stop. You have to keep going.
Yeah. Definitely, you have to keep going, keep pushing through. So what motivates you to do all these things? You have so much going on.
Yeah. Yes, true. You know what? I think I get motivated by life, by seeing others. I'm like, you know what? I can do this. I can do this. And they look at me and I'm like, yeah, I can do this. Like, when I came and I said, I'm going to have a podcast. And my husband was like, do you really have that much of a free time? I said, I'm going to do a podcast. What do you want? I'm going to do a podcast. And there you go, boom. And now he's like, yeah. And I was telling him the other day about the video. Yes, you have to talk about this and, make the people aware of what's going on. And I said, yes. So now I have a voice. I have a voice.
Yes, I saw that you were posting and you were mentioning a little bit about it earlier, about somebody is scamming people.
Yes. So let me tell you quickly, because I know people maybe they have, oh, I have some of our, hey Tracy, how are you, honey? So yeah, so basically it's a scam. It's called the veneer tech. So a couple 2-3 months ago, somebody went on TikTok and showed a certificate, and he goes, I got a veneer tech certificate. I paid $1,500. Now I can put veneers in people's mouth.
Oh, wow.
Do you understand how crazy that is? So some people, they're like, oh my God, how did you do that? It's all on TikTok.
Yeah.
They went and then they had some sort of an institute in Atlanta. They got some dentists, illegal dentists from another country. They started to teach the people for 2 days, $6,000. They took $6,000 to teach them for 2 days, 2 days to cut people's teeth, and put veneers.
Wow. A fake
The crazy thing,
use it.
The crazy thing is people actually believed them and they followed them and they went to see them. People went to see them to get veneers that they bought from Temu and Amazon.
That's insane.
It's beyond insane. It's happening in the United States.
Yeah. People taking advantage of other people. That's always like very sad.
It's like crazy.
Hard work too on top of it.
It's crazy. Yeah. And they are paying them like they're not paying them like $100. They're paying them like thousands of dollars. Why would you do that? Why don't you go to a dentist?
They want to
work
save
something out.
Money. Yeah, I think it's the same as like, like the girl that you were talking about. She went to another country, she did all the teeth, and now she has all this infection because she, in follow-ups. It's like when you do something like that, you have to do follow-ups.
You have to check, and you have to basically honor what you're doing. But the thing is, and the crazy thing is, yeah, those veneer tech, they went all over TikTok, and they kind of, I don't know, they had like a place in the basement of somebody's house. We're so busy. That's what they were saying. Look at the smiles. We're so busy, blah, blah, blah. And the people, they bought into this.
Yeah.
They bought into this. And they went in not knowing that, we're talking teeth, we're talking head and neck. Forget about the rest of your body now. Like they thought it's like, when you put fake nails on your...
Yeah.
Fake nails is something completely different, because this is, you're discussing, there is like vital structures here. There is like veins here. There is like blood vessels here. There is a vein here, the facial vein. Yeah. This vein specifically, and I'm going to say, I don't want to scare anybody, but that vein, if something touched that vein, most of the veins, they have like a little valve, so it stops the blood from going the other direction. That vein doesn't. So if something gets in there, this is straight to your brain. That's a brain infection, brain abscess, straight.
Wow. Dangerous.
Very dangerous. So anything in the head and neck, we are always like head and neck. We always stay away from the head and neck. We have to be extremely careful. Even me as a dentist, like when I'm placing implants or something, I take I have a 3-dimensional X-ray. I cannot work without it. Implants specifically, because you need to know your vitals, where the big nerve is, where the sinus is. You have to. So imagine you're putting veneers on teeth that you don't even have X-rays for them.
Yeah.
What if there is an infection? What if that infection blow up, goes to the brain? The person can die from something like that.
Yeah. And there's some, Dr. Sharon said some people they do this are because they're desperate and they just probably can't afford it. And they go the easy way,
But here is what I'm going to say. You can always go to your dentist and work something out. You can go to your dentist, work something out. Yeah. Like there is so many ways you can work something out.
Like a payment plan, like
yes, you can work something out. Of course. I mean, dentistry is not cheap, yes, but we can always work something out, because imagine like how many years and the equipments, and it is a very expensive profession.
Yeah. How long?
But we can
How
always
long does it take to become a dentist?
how say that
How long,
again?
how long does it take to become a dentist?
A lot, like many years, many years, a lot of years, because you have to do the undergrad and you have to go to dental school if you get accepted, because it's not even easy for you to get into dental school to begin with. Then when you finish, you have to do residency, then you have to practice, and until you get to the speed of doing this and you know exactly what you're doing, it takes you at least 10 years, at least minimum.
Wow.
Minimum to really excel, like, okay, I can get into the speed now.
Wow, that's incredible.
It takes a lot of time, and then you will graduate with tons of debt. Forget about like tons of like
Oh, no.
probably like 2-3 houses like that. Like, yeah.
Yeah. It's crazy that you have to go through so much
Yeah.
to become a dentist or a doctor in general. It's a lot. I mean, you definitely want them to be prepared.
Yes, of course. And because I'm saying we are dealing with people, we're dealing with life here. Head and neck, it's not like, oh, I got a cut in my finger. This is much more serious. Head and neck, right next to all the vital structures. So, of course, we have to be extremely qualified to become dentists.
Yeah. Yeah. So, let's talk a little bit about things that you haven't told us that you would like us to know before we completely close out session.
I want to know if anybody has any questions for we talked about a lot of stuff.
Any questions here? Yeah, I haven't. Somebody say that Dahat. I can't pronounce the name. Dahat Dental. She said hi.
Hi, how are you?
Yes, we have a lot of hi, but no question. Do you have any question? Anybody has any question for Dr. Saad?
Maybe we'll keep the questions till the end then, if you know.
Oh, keep the question to that. We'll see.
So what else? I have, as I said, a nice cat. I love to. I speak 3 languages, if that helps. I'm learning Spanish, poquito. Poquito. Habla español, poquito.
Me duele.
I only know like apreciera and mastica.
Duele, probably like her.
Yeah, like a little bit. I'm working on it.
Awesome. And how do you learn all the different languages? I mean, I know the one that you were born in, and then
so I was born in Egypt, so I speak Arabic, of course. Then I went to a French school, so I speak French fluently. And French is very close to Italian, very close to Spanish, so I kind of would understand, and very close to Portuguese too. So the funny story, and I love to travel, by the way. I love traveling. So a couple of years ago,
you just came from a trip somewhere for you.
I was in France.
Awesome. How was it?
That was fantastic. We did a road trip. We drove.
Wow.
All over the country.
That's good that you take some time for yourself.
Yes.
To enjoy.
And this is very important. And I think it's very important for everybody. And I'm not talking, okay, but you have to take a little bit of time off for yourself. Do something that you really enjoy in the day or during the week, but you have to do something for yourself.
Yeah.
Because you have to shut down. Otherwise, you're going to be completely burned out.
That's so true. Like, I just came from my mini getaway. We went to Virginia, and I was like, the first 2 days I came home and I was from work, and I just went to my room and relaxed for a little bit, and just taking some time for myself, just from a vacation too.
Yeah. True, but you know what? You feel good about yourself. You feel good when you come back.
Yeah.
Even if you go to the beach 2 hours. I love the beach.
Yeah.
I just love to sit there and just kind of try to disconnect.
Yeah, that's awesome. I like going to the beach, but I'm not in love with it.
That's okay. Anything that makes you happy. Anything that makes you happy.
Yeah.
Walking, hiking, staying in your bed, whatever makes you happy, you have to do a little bit for yourself.
Definitely.
We owe it to ourselves.
Definitely. So, what message do you have to everybody besides from like do something that you love? What else to like recharge yourself? What else do you want to tell us before we close up? It's been great talking to you, but I know everybody has something to do. We have a few people hanging in here.
I think if you have a dream, you really have to follow your dreams, because all of us, we are born on this earth for a purpose and a dream. And you just need to, you have a dream and you have to work hard and you need to get to your dream. That's it.
That is so true. You have to like get to your dreams, and sometimes it's not like as straightforward. That's the thing. Like sometimes we just get so many obstacles. Some people will just give up. Just keep on pushing forward. Keep on moving forward. Keep on like going. Just keep going.
Keep going. Absolutely. Absolutely.
Oh, it was awesome talking to you. Thank you so much for your expertise. And everyone, make sure you follow Dr. Saad and log in into her bio. She has all the links to all the different things that she's involved in. And go to her office. She has an amazing office. I can't wait to see it. I'm going to be there sometime soon. So enjoy.
Come and feed the fish. We have koi fish.
I'll go and feed the fish. I know. I was planning to go. You had an event the other day, and I wanted to go, but I had something else going on. But I'm sure soon you're gonna have something that I'm gonna be able to make it.
Excellent.
Yes, but going to her channel, she has a lot of information, and in her YouTube channel as well as her podcast. Whichever way is easier for you to get the information, listen to it while you're driving, and get more information about your teeth and your dental health.
Thank you so much.
You're welcome. Thank you. It was great talking to you.
Thave
Thank you.
a good one, everybody.
See you.